Stan, I'm so honored to have you back on the show. We spoke several months ago around Pearl AI and some of the advances in AI that we're seeing today in dentistry. From speaking in Brazil to your own courses you're having to just all of the things you're doing to better the field and the health of these dentistries. I'm really thanks for taking the time to jump back on the podcast with me.
Yeah, sure. I'm glad. I'm glad I could make it. Happy to be back.
I don't know that I've ever asked you the question, but I know at one point you were, were and still are practicing. Tell me the journey to go from this is where I'm at to what you're doing today. I mean, you're everywhere.
Yeah, I'm all over the place. Well, I was always speaking. So ever since actually in dental school, I started speaking because I started writing research in dental school. So I'm one of the rare dental students that started speaking. And so I've been speaking now for, 16 years, something like this. So I always had that aspect in my weekly career. It was like I would work 4 days a week, and then I would leave on Thursday to speak somewhere on Friday, and then come back on Saturday. So that was always in there. Now, why I really started to limit my clinical practice down was really when we started Pearl. We started Pearl really as a little project. It turned into now a fairly large company valued at, a few $100 million. And it got very serious to where I had to start taking time off. And so it was a long process. It was 7 years really of transitioning out of clinical practice. So it was 4 days a week, then 3, then 2, then 1, and once every other week, and then once a month, and once every third month. Then I was just treating friends and family. And then it was like, what am I doing? I was starting to get rusty a little on the clinical side. So I've really moved more into education, which I've always had a love for, but now I'm also really involved in the dental startup world, advising, investing. So yeah, that's what I'm focusing on now.
Now, in those 7 years, what do you see as the big markers and milestones and changes in our space today?
There's so much change happening right now. Some is for the good, some is for, I think, the bad. I would say on the good side, we do have a lot of great technology that's coming out. This is limiting liability for dentists, making things better to communicate with our patients, communicate with our team, allowing dentists to have more time off, allowing us to be more predictable. When I was practicing a lot more, I was very big on predictability. So one thing I always used was guided surgery. I was trained in kind of a perio-pros way. So I was placing my own implants and restoring them. And I was very big on guided surgery simply because of the predictability. And now you have a lot of other technology that's coming out too, software or hardware that is making things more predictable and increasing that communication between the team, the doctor, the patients. And so I think dentistry is going in the right direction. It's getting better slowly over time.
Now, I have a theory, and I wanna run it by you and test this out here.
Let's hear it.
2014, 2012 era, I believe if you were a great dentist and an average leader, you probably did really well.
I would agree.
2024, if you're a phenomenal clinician and an average leader, you're probably struggling and you might even be a great employee somewhere else. How does that sound to you as you've gone through your journey over these few years?
Yeah, no, I completely agree with you. And if we take it back even further, because my dad was a dentist for 46 years, my brother's been a dentist for 20 plus years. When my dad started in the 70s, you didn't have to be anything. You just
Had to
put
have
up
an
a
open
sign
door.
that said dentist, and
Yeah.
you made pretty good money. You were probably successful. You took off, 4 weeks a year and made a few $100,000, right? I mean, that was honestly what it was like if you started in the 70s or the 80s or the 90s. Things have definitely changed now. We have a lot more competition. There's a lot more marketing, of course, coming from everywhere. And I think what happened was what you see with DSOs and DPOs is they realize that, oh, we have these great clinicians, but they don't know anything about leadership. They don't know anything about business. So what did they do? They brought in great leaders. They brought in great business experts. And of course, that's why that sector of dentistry has been growing like wildfire, is because they realized we ran these great businesses, but they weren't really maximized. They weren't really efficient. We weren't reducing our costs. We weren't reducing our liability. And so that's what the DSO, DPO world did. Now if you're a single practitioner, or if you're, a private practice, not in the corporate world, you're competing with the leadership, the marketing of those other groups. So that becomes much more challenging.
We see it on our side in marketing. A private practitioner will say, I get referrals. I don't need to invest in marketing. Those didn't come from the internet. They're very myopic. And this is my patient. This is the internet's patients. This is, this where, DSOs, to your point, I mean, they understand multi-channel attribution. They understand cost per acquisition. They understand what a prospective patient costs to attain then in revenue. And the practitioner's like, no, these are referrals, so I don't need to invest in marketing. That's how we see it on our side. And the gap continues to get wider and wider. And as it does, from our network of offices, we're seeing mental health and overall job satisfaction and income, all of these things begin to take a hit in there. And I know you spoke on mental health for a little bit. You have these competitive factors. It is hard to be a dentist sometimes, physically. How are you seeing it impact mental health today?
Well, I think the problem is that many dentists forget that we're running a business, and they don't want to run a business. Most dentists, I'll say 99% of dentists, didn't get in and say, I'm going to be a great business person. They said, no, I want to work with my hands, and I want to be a doctor. I want to help people smile. But most of them don't suffer in that aspect. I mean, most dentists are great dentists.
Mm-hmm.
They're not great leaders. They're not great owners. They're not great business people. And that's where I see a lot of them suffer. That was like me. I was a fairly good dentist. I was trained by Pascal Magne and Christian Coachman and Sasha Jovanovic. I mean, some of the top guys in the world. But where I suffered was in a lot of these soft skills. And for those of you that don't know my story, it was February of 2018 that I came home and told my wife that I was going to quit dentistry. And from the outside, I really had everything. I had a celebrity practice. I was making hundreds of thousands of dollars. I was driving a nice car, living in a nice area, lecturing on, the top podiums around the world, publishing in all the top journals, but I was miserable. Mm-hmm. And what I was suffering from was patient challenges, team challenges. So I had to go on this journey. And I went on this journey to realize what I was missing, why I was feeling burnt out. And I started focusing on positive psychology and the science of communication and all these things that we're never taught in dentistry. We're taught like how to prep a crown, how to take out a tooth, how to do a denture, right? Mm-hmm. But when I started focusing on these when I started focusing on these very profound topics, my whole life changed and my health got better. I started making more money. We grew Pearl to a fairly large business. And it was all about these soft skills. I was still the same dentist, but now I knew how to set expectations. I knew how to have boundaries with people. I knew how to communicate this too. I knew how to have crucial conversations. That made me a better leader, which grew our practice too, and really changed my career. So I think it's dentists thinking they only have to have good hand skills. But really, you also have to have good head skills. You also have to have good heart skills. Those two are what most people are missing. And when I can get dentists to have this awareness, and then they put time and money and effort into this, and some of them come to my online courses or my in-person courses or coaching with me or someone else, their life changes because they're already great at dentistry, but now they set expectations with patients. Now they set boundaries with their team members or with their family. Now they become great communicators and they just thrive.
Now, do you think someone needs some aha moment or, because I think of something like the region beta paradox, which is, they use it in medical. If my shoulder's kind of a bum shoulder, but it's, 3 or 4 of 10, I'm likely to never rehab it, right? I'm just going to live with the pain in there. Where if I had to have a complete rebuild, I'm likely to rehab, take my medicine, work hard. So, the region beta paradox is, paradoxically, if something goes far more dramatically worse, you'll have a more positive outcome if it just stayed, there. Do dentists have to go through that? Do they have to have a massive failure? Do they?
It's a good question.
Can you bring them to the light?
Yeah, it's a good question. And have you heard the story about the dog sitting on the nail? It's kind of the same thing, but this guy walks up and there's a man sitting there holding his dog, and his dog is whimpering. And he goes, why is your dog whimpering? He goes, well, he's sitting on a nail. We said, well, why doesn't he move? And he said, well, it doesn't hurt bad enough. And I think that's exactly what you're saying is I tend to see that the dentists that take my courses, the dentists that make these big changes, they do go through burnout. They do go through a very challenging time. I wish that wasn't the case. If you have like an upside down U, and I would rather catch people before they go to the very bottom of the U, right? Just when they're on that little tiny down slope, that's where I want to catch them and bring them back up. Unfortunately, what I see many times, and this was me too, is I didn't even have the awareness that something was wrong until I was at the very bottom. Awareness is everything. And most people don't even have the awareness to then make the time, the effort, and put the money towards changing something.
I'm trying to think through the times in my life that I have gone through that, on the downside. And my business was always good. And I'm going to see if this translates into dentistry. Obviously, running an agency and, business owners. I did notice that my marriage began to get dicey, and, I started, spending less time at home. I began to want things that were probably outside my ability to buy. I began
earning
to
potential.
My earnings stayed good, but my aspirations began to outstretch things.
Yeah. Hedonistic adaptation.
I started to be reactive when challenged by clients. Like when a client would come and say, well, you didn't really do anything for me, I would, fire off.
That was a big one for me. I was very reactive.
Very reactive. I noticed I started turning over my staff. Now, I justified it because they weren't a good fit.
Yeah.
But really, they were I was losing good people. Now,
yeah. And there's research to show that you spend about 200% in finding every new staff member. So, let's just say easy math, right? You pay someone $50,000. You're going to spend $100,000 on finding the next person. You may be like, well, what do you mean? No, I just put something on Indeed and I find something. Yeah, but what about those 2 or 3 months that you didn't have anybody? And how did your production go down? Did you lose a patient because there was bad communication when you had a temp in?
Right.
So all that kind of stuff. Good research on that. That's been a big push for burnout education, and a lot of people are calling it resilience education in the dental world. I'm working with a lot of group practices now, DSOs, DPOs, on creating wellness programs for their businesses now, because finally the bean counters at the very top, I don't think they really care about the dentist, but they care about the dentist making them money.
They care about the numbers behind it.
Yeah, and so they start saying, oh, wait, we're losing money if people are burnt out. They're not as efficient. There's more absenteeism. There's more employee turnover. Oh, well, then we need to do something about it. So, I'll take it because obviously I can help people, even though it may not be coming from the right place. But that's why there's such a big push in this now, because people are realizing that this is impacting not only, the mental and relational health of our team members and of the doctors, but it's impacting the money.
And what are you telling them? Because the other sign I hear from dentists, and you can almost, I can almost hear some of them say it, that one of the signs I know that they're burnt out is all my staff are idiots. That phrase specifically, like as soon as they say it, I know, oh man, this person's life must suck. What does it look like? Because any time that I have truly been disenfranchised with myself, I didn't know I was mad, but I was probably more mad at myself of not being able to break out of it at some point than I was, in the shame spiral and things like that. What are you saying to them? How are you helping them go from, if they're on the down slope or they've already hit bottom, what do you tell them?
Well, first step is awareness. I have a framework. It's called the Ripple framework. And the first thing starts with R, which is realizing that there's a problem, realizing that something is different, realizing that you're not as effective as you used to be. So I'm a researcher. I came from the research world. So when I was trying to diagnose myself and figure out myself, what I did is go to the research. And what you find is that, a lot of people think of burnout and mental health and this stuff is kind of fluffy and woo-woo, but there's so much research behind it. I mean, there's hundreds and hundreds of research articles that have big, large studies and, very well done research. And when you start to look up burnout, there's a definition of it. And it's usually incorporated with three things. One is being exhausted. This is going to be physically exhausted, mentally exhausted. One is feeling cynical, and the other one is feeling ineffective. And once I learned this, I was like, oh my God, that was exactly what I was going through. I was physically exhausted. My back hurt. I was working on patients all day. I felt cynical about it, what you're talking about. My staff sucks. My patients are annoying. And I felt ineffective. I was having complications with cases. My case acceptance was going down. I definitely felt ineffective, like I was spinning my wheels.
Yeah.
And so when you take those three together, those are ways for people to realize maybe that is what's happening. For me, I was also crying more. I was sad a lot. My heartbeat when I went into the practice, when I opened the door to go in, my heart would start pounding a little bit. It was like this fight or flight PTSD from having bad experiences.
No. And what does the turnaround look like after you have this awareness? Because, you've established some paradigm with your staff, and this is how you've operated. You've established some paradigm with your patients. How are you working through that as a dentist?
So again, I'll take you through my ripple effect, which is my framework. Number one is realizing there's a problem. That's the R. The I is identifying these triggers. So there's triggers that we have in dentistry that you may not even realize. When a patient says, I hate the dentist, or I was fine until I came here, or giving injections when it's hurting people. There's little things that bother us that are so specific to dentistry. So that's the second part. The double P is purpose and perspective. That's finding a purpose outside of dentistry. And that may sound silly to some people, but so many dentists, including myself, I was one of these, that our entire purpose in life is doing a great margin, having great implants, growing a big practice. And we have to realize this is our job. It's what we do for work. You can love it. You can be passionate about it, but it's not who you are. The L is for learn. That is where you learn and explore the daily habits that are very much research backed. So I call this the dream sequence: diet, relationships, exercise, appreciation, meditation, and sleep. And then the last one is E is for elevate. And that is really where you get into leadership. That's where you get into practice management for mental health. Now, most people do practice management for money, right? Let's do practice management to grow the practice. I went about it the other way, which is, how can I make my practice so that I'm happier? Very selfish way of thinking about it, right? However, the side effect is we created a great culture in our practice. Patients love to be there, team loved to be there. And the other side effect was we grew our business pretty significantly. And some of that is dismissing patients, having boundaries with patients, setting the right expectation, increasing our communication, protecting our team members. When a patient is being rude to them, coming in and saying, I'm sorry, man, but you can't talk to Diane like that. And, if you'd like to continue to be a patient here, we're going to need you to respect our team members. So that's the framework that I go through with people that now we've trained, over 1,500 people from 30 countries.
I listened to a couple of your podcasts, and you were talking to Dr. Mendelsohn.
Yeah.
And you were talking about how big cases are learning to spot the problem patients and not chasing that money. That's tough when you get it all on four come in.
It's very tough. And it's very tough when you have $500,000 in school debt and $1 million in practice debt too.
Yeah. Now, what are the signs you see? Because obviously you hear about it after the fact. And if I take this journey and apply it to us, there are certain phrases we listen for when we're talking to a prospective client. And I don't need to do marketing because all of them are referral. I mentioned that earlier. How much do you pay your SEO person? I don't know why they care about how much we pay them. It's like, I don't know, how much do you pay for ceramic block? I don't know.
Right, yeah.
Why would that matter to you?
Yeah.
I know they're trying to price shop, right? Like they're trying to get to like, how much does it cost me to service an account?
Yeah.
Kind of question. What are the things that patients are saying that just chill you to the bones?
I think when patients come in, I call them binder patients. We have a binder rule at my practice. Someone comes in with a binder full of all of their records from the last four dentists, and the last four dentists, like you said, were idiots and none of them could get it right. I'm not going to be the fifth dentist that's going to get it right. Now, early in my career, my ego made me take a lot of these patients and say, oh, well, yeah, you're right. All those previous dentists are idiots, but I'm not. I'm smart. I'm better than them clinically. So I'm going to be able to help you. And, I think you probably know how it went. These are the patients that did 100 sets of temporaries and they didn't want to pay for anything that you had to redo, and everything was taking too long. And these patients drive you crazy. And even when you have these big cases, like you probably heard on our podcast, even when you have these big cases, you don't actually make money on them many times. You have to be very efficient. You have to really know that they're going to be a good patient. Because let's say you do a $30,000 case, single arch, all on four. You think you're making $30,000, but your front office is on the phone with them for 2 hours, complaining out stuff. You're writing emails back and forth with them. You're going back and forth with the lab because they said, oh, the distal of this little incisal edge, I want this to come up because I want to look like Christy Turlington, And when you look at the per hour that you make, many times you lose money on these patients. And not only that, these are the patients that, in my opinion, will threaten to sue you, want their money back. They have these high expectations. I think the biggest red flag for me is unrealistic expectations. I created a whole course on this called the complication compliance method, which is how to set expectations with patients so that they know what to expect and what the fees are going to be, how much time it's going to take, how long they're going to be in temporaries. Are they going to talk funny? Is it not going to be the right shade the first time or during the provisional phase? Because what I did incorrectly was overpromise and underdeliver. And that got me in trouble. Many times patients are like, well, you said next time I come in, I was going to get this crown. That's right. But what about that 3%? Those are the patients that you didn't realize in 2 days is their daughter's wedding, or they're leaving for a 6-month cruise after that, or, they're leaving the country. I mean, all these things that you don't know. So I've got really big on under-promising and over-delivering and communicating that, because a lot of dentists, we never learn that.
It is scary to under-promise because you feel like someone else is out there in our competitive landscape. And it gets to the abundant versus scarcity mindset.
Totally.
You get to this, someone out there's promising them, it.
I'm glad you brought this up.
I'm going to have your teeth in a day. Oh man, I love marketing against people that do teeth in a day. Why would you want teeth in a day? But I feel like that drives so much of our behavior. Andre, my business partner, and myself, we used to be so scared at setting expectations with clients when they signed on because we were just so scared we were going to lose them. And I've had so many bad accounts that I hate to say that to be so negative. I just hated working on it. I didn't even want to do a good job at some point because they were just so miserable.
Yeah.
And then but I felt trapped because I took, their $5,000 or $10,000 a month to do marketing, and I felt trapped.
Yep.
And I don't think I ever had one in good, but it gets into, there's something around that abundant and scarcity mindset.
Yeah, you hit the nail on the head, because usually when I talk to people about this, and let's say you're talking about an implant, how I talk about it now is much different than how I talked about it when I first started practicing. Now I say, we're going to place this implant. Implants are very predictable. However, there is a small percentage of patients where this may fail. And if this happens, you have to pay for it again. And people are like, oh my gosh, but what if the patient leaves? I'm like, good. If they have unrealistic expectations, you don't want that patient in your practice. You want patients that are realistic. Like, yeah, it's a human body. You're a human. I'm a human. And after you place this screw in my mouth, I have to chew and kiss and swallow and eat and talk and breathe. It's not like other parts of the body or other businesses. I mean, this is your human body. We can't predict this. Your bone is different than my bone, and my blood is different than your blood. There's so many factors that you have to have patients that have the right expectations. And so the whole idea of setting low expectations is to weed out the patients that don't have the right expectations.
That's right. I don't want them in the practice.
Yep.
And it sucks to give up the money, but you're not actually giving up the money. You're giving up some heartache.
Yeah. And my practice is in a 9-story building. There's 52 dentists in my building. Okay. We're all doing okay. Like there's plenty of people
Hmm.
in the world, you know?
So many.
I mean, they can literally walk out our door and walk 3 feet across the hall and go to another dentist. And sometimes they do. But guess what? Sometimes they do the opposite and they come from another practice to our practice.
Mhm.
I've become friends with all the people in my building. I mean, I used to be very competitive with these people, and I realized everyone's kind of doing okay.
Yeah, we're not competing with other dentists. We're competing with education. We're competing with unrealistic marketing.
Yeah.
The teeth in a day scares the heck out of me. The practitioner coming out of school and wanting to specialize on all on fours, scares me as a marketer.
Yeah.
We're competing with those things, perhaps, but not certainly not another dentist per se.
Yeah.
Failure rates. Gosh, Dr. Stan, thank you so much. I'm going to link out to your podcast, link out to your site. If you want to learn more about Dr. Stanley, it's going to be in the show notes. And gosh, in November, you've got a thing in Irvine,
Yep.
you're Minneapolis, you're going to Las Vegas, and then in the winter, you're getting back in Riverside, and I know you're doing some stuff in Montana. So from coming up quick in November, and then January, February, and March, you've got some nice events coming up that we'll link to.
Yeah. I'm all over. So yeah, you'll find
Man,
me.
good for you.
And
Yeah, buddy. From Bozeman to France,
yeah.
you're getting all the territories covered there. Yeah.
Yeah. Yeah. I'll be in Brazil and Minneapolis and New Orleans and Cannes, France, and
Hmm.
gosh, Charlotte. I mean, yeah, I'm all over the place.
Yeah. We'll link all this in your show notes. But Dr. Stanley, thank you so much for your time, and hope to have you back in a couple months, buddy.
Yeah. Let's do it again.